Hi, I'm Dr. Lisa Palmer, and I'm here to talk to you about one of my favorite products, Wow Whoa or Wow Woo. So, this is Woo Oil or Whoa Oil, depending on your pronunciation. And it's China Healing Oil from Systemic Formulas. It's one of my favorite products. I love it so much that it's always in my purse. This is my go-to. So like you have your favorite supplements. This is like one of my top favorite supplements. And I'm going to give you so many uses that it will become one of your favorite top products from Systemic Formulas. And you'll keep it in your purse or in your car, in your briefcase, and you'll definitely want to stock it on your shelves at your office. One of the things I love about this is there's so many good healing properties in it that you can use it for many uses. I'm going to give you a list of different uses and how you can use it with patients and how you can use it with yourself, your family, your kids. Okay. So the first one is I like to take this and application wise, you can put your finger on top and just kind of dab it for yourself and say that you're at a family picnic and you're standing in the grass and you get bit by ants. Whenever an insect bites you, whether it's a ant or bee or wasp or some kind of funky spider, especially spider bites, when the insect bites you, it can inject bacteria, viruses, and even parasites into the skin. And sometimes you'll see the body will raise a red bump. Sometimes it's red and it has like a pustule in it. What you do is you put a little bit of the woo or the woe on your finger, and then you can dab it on that insect bite. And what it'll do is the healing oils will help counter the effects of bacterias or viruses or parasites or whatever nasty stuff that insect injected into you or into your patient or into your child when it bit you. And so I've had patients come in with weird, funky bites, and we have no idea what it is. Through muscle testing, we test it and we can determine, what kind of immune challenge was it? Was it a bacteria or a parasite or a virus? If you don't do muscle testing or you're not familiar with that, that's something you can be trained in. Or you can just test to see what's the right formula. 9 times out of 10, this is going to handle the bite. So love to have this in my purse. Great for the first reason, which is insect bites. So good to have. Your kid gets bit by ants or you get bit by ants, you dab a little bit on your finger, put it on the bite, and you're good to go. And it just helps that area heal. The other thing I love to have this in my purse for or have it at the office for patients is upset stomach. So you're traveling, you eat at a restaurant, and then after you eat at the restaurant, you just don't feel amazing. Again, you can dab a little bit and put it on your tummy, your kid's tummy, your husband's tummy, your wife's tummy. And it just has a nice calming effect. It helps with GI distress. Another use is upset stomach. Clogged sinuses. Oh my goodness, the pollen count down here in Florida is a 12. It's off the scales. Our windshields are covered with yellow pollen. Our cars are turning yellow. It's just like pollen everywhere. I have patients coming in with little pieces of pollen on their jacket and their hair. A lot of people are having problems with pollen, and it's really wreaking havoc on their sinuses. So the maxillary sinuses are located here. The frontal sinuses are located here. Again, you can put a little bit on your finger and apply right here on the maxillary sinuses. Do be careful though, because it's very close to your eyes. And Whoa is such a powerful oil that it can cause tearing. So don't get it in the eyes, and make sure if you're going to have your patients do that, you let them know. And the Whoa will go into the sinus cavities and can help clear out the irritants of pollen. So you can put it here on the maxillary sinus. You can put it here on the frontal sinus. And if it's congestion, so some people, when they're sensitive to extreme pollen or they have congestion from a virus or a bacteria, they get blocked up ears. One of the signs of blocked up ears is they can't hear you. Or when they swallow, you hear like a crackling noise. You can take a drop of the Woo and you can put it behind here on the mastoid process on both sides, and that can help decongest ears. So again, you can see how I love this product. It's super amazing. Stinky situations. I don't know if you've ever been flying on an airplane, and one of the last trips I went to Nevada and Las Vegas, and we were on the airplane, and all of a sudden it didn't smell so good on the airplane, and it's not like you can open a window. So one other good solution is you can take this and put a little bit underneath your nose, and it has peppermint in it, spearmint in it, and so it smells really nice. And instead of smelling the not pleasant smell or using fake perfumes or fragrances, so I don't know if you've heard of air pollution from fragrances, but fragrances can cause respiratory problems, allergic reactions, because what are they made out of? They're made out of chemicals. So the chemicals are all carcinogenic or cancer-causing chemicals, and anything that touches the skin gets absorbed into your body, right? Your skin's your largest organ. So if you're using a perfume or a cologne or a fragrance and you're putting it on your skin, you're absorbing those toxins. And I'm guilty of this too. As a female, I used to put perfume right here. And what is this? Thyroid gland, right? And or you put it behind your ears. So anything you're putting on your body that's a chemical your body's absorbing. Instead of using a harmful chemical, such as what's found in a perfume or a fragrance or a lotion, you can use this and smell pepperminty, and that can help. So stinky situations, like when I was stuck on the plane and then it didn't smell so good, I put that under my nose and my flight was very nice and enjoyable. If you are with a patient and then maybe the patient has some body odor, you can put some of this on a tissue and kind of wisp it around your room, and your room will be smell nice and pepperminty. You can use it for, like, say you're changing a stinky diaper, for stuff like that. Maybe your car doesn't smell so pleasant. Also, coffee breath or stinky breath. So you're doing a lecture, which is kind of funny because you can't smell my breath because I'm on a webinar. But if you were to, be speaking with a patient or, on a hot date or something like that, and you're concerned that your breath doesn't smell so good, you could put, and you can't brush teeth, you could put a dab on your tongue and you will have like extremely minty fresh breath. So stinky situations, whoa. So you guys are starting to see, if you don't know already, how very, very valuable and how useful this is. Parasites. Oh my goodness. We are seeing such a problem with parasites down here in Florida. As you know, parasites can cause bloating. They can cause nausea, vomiting. They can cause weird skin rashes. They can cause flatulence or gas. They're just miserable little creatures. So if you know that your patient is suffering from parasites, they can take the woe and they can put that on their stomach, and it'll actually calm the parasites down if the parasites are affecting the GI tract and the intestines. You can also, we find that parasites are more action or more active during full moons. So it just seems that like the fishermen know that worms are more active during the full moon. They are attracted to the light. They're attracted to the lunar cycles. So if you were digging for worms, you would dig for worms on a full moon. Farmers follow the farmer's almanac. I know it's good to plant certain plants during moon cycles. So we find that parasites are also more active during certain moon cycles, like full moons. If that's the case, then you know your patients are really suffering with parasites. They can take the woo and they actually can put it on their stomach at night, like the whole bottle. They can just hold the bottle on their stomach at night, and it'll help calm down the nasty nausea, vomiting, gas, cramping, abdominal cramping from parasites. You can take a drop of the woo and you can put it in VRM1. So VRM1 from Systemic Formulas and VRM2, these guys are for larger size parasites. Okay? If you're doing nutritional response testing, that corresponds to parasite vial 1 and 2 in the nutritional response testing test kit. Or if you have knowledge that it's a larger parasite, you can put the woo oil, a drop of it, inside the capsule. So you would actually open up the capsule and you would put a drop of the woo in, and that way the woo is going to get lower in the digestive tract and help you get rid of buggies, parasites. The same thing can be done for the VRM3 and VRM4. So these products also can help with immune challenges that are parasitic and related. These would be more medium-sized parasites, and 4 would be more microscopic size parasites. If you're doing nutrition response testing, that corresponds in the nutrition response testing test kits to parasite vial 3 and parasite vial 4. So VRM3 going with 3, VRM4 going with vial 4, parasite vial 1 goes with VRM1, and parasite vial 2 going with vial 2 goes with Verum 2. And so that's how that works. You could also, if the person's doing coffee enemas, you could use the liquid formulas in the coffee enema. So you could put a drop of the CX Verum 1, which is the liquid formula of this, so great for enemas. CX Verum 2, which is the liquid form of this. CX Verum 3, which is the liquid form of this one. And CX Verum 4, which is the liquid form of this one. So I've had stubborn parasite cases, and then we've added in coffee enemas. And in the coffee enema, we put the CX formulas in, and perhaps you would do, CX Verum 1, 2, 3, and 4 into the coffee enema, along with a drop of Woo, and then you actually can see the parasites coming out when the person does the enema. And what's becoming a problem right now is called ropeworm. And ropeworm looks like a rope, and it's a sneaky little worm because when it goes into the intestines, it becomes part of the intestinal wall. And so it's almost like you have a tube and then you have another tube, this being the ropeworm. And so the food and liquid and all that's being absorbed by the parasite, and your patient's literally starving because the parasite's absorbing all the nutrients in the intestine because it's become like the intestine. So when you do a coffee enema, you can get that ropeworm to come off the intestinal wall, and when it comes out in the enema, it can look like a piece of rope. So you'll have your patients tell you they see lots of interesting things like parasites with little antennas and little pieces that look like spaghetti, but those are parasites, or something that looks like a piece of rope. So those are all signs that larger sized parasites are coming out. So I always say better out than in, because those little guys wreak havoc on a digestive system and on a system in general. And then migraines. So your patients that are suffering from migraines, say that the migraines on this part of the head or on the back part of the head or wherever it is, they can take the drops of the Woe and they can put it on the migraine site, and sometimes that'll help alleviate some pain. So when you're traveling or you have tough cases or you want to give the patient something that they can do, you have Woe oil that they can have in their purse, in their man bag, in their suitcase, with them at all times, and it can handle so many things. So there's my Woe wow tip for this product. If you don't have it, if you don't carry it, get it on your shelves. This would also be a good thing that you could do a seminar for your patients and just give them all the bullet points that I just gave you, from insect bites, upset stomach, clogged sinuses, clogged ears, stinky situations like the bad breath or the stinky airplanes, parasites, anything with parasites, and migraines. I hope that this little webinar has given you some information on what you could use, how you could use this product, and I look forward to seeing you at the next Systemic Formulas event. I wanted to give you guys a specific case study regarding the Woo, since again, favorite product, so amazing. I had a lady come in with the worst looking rashes from her knees down. They were red and peely and awful, and just, oh man, she was really suffering. She had been to a dermatologist, she had been to a specialist. She just had no results whatsoever from her shin down. It was just peely and rashy and red, and she would scratch it so hard she'd be bleeding. I mean, she was just really, really suffering. And so when this lady came in, we did nutritional response testing on her, and we found out that rash actually had a cause, because anytime someone has a rash, there's a cause. And she tested for parasite vial 1, parasite vial 2, parasite vial 3, parasite vial 4. So she had all 4 types of parasites. So parasite 1 and 2 is, large parasite for 1, and like a little bit smaller for 2. 3 and 4 are microscopic, medium, and then microscopic. She had all 4 on her skin and in her skin. And that's why the treatment from the dermatologist was a steroid cream. And then she was putting lotion on it, and she wasn't getting any results because the dermatologist wasn't looking for the cause. And I feel so bad for dermatologists, because they see something and then they guess. And usually it's a steroid cream, sometimes an antibiotic. Would an antibiotic help with parasites? Well, no, antibiotics are for bacteria. So we got her on Verum 1. We got her on Verum 2. She also took Verum 3 and Verum 4, so she had a heavy parasite protocol. Remember, with the parasite protocol, you either want to use ACP or ACX as the drainage. Which one do you use? Whichever one they test for. So I would place the ACP on her and test, and if she tested strong for the ACP, I could use the ACP. If she didn't like this one, I could test her for the ACX. And so as we started doing that, on the rashes that were not open, we also applied the Woo. And this really helped with the itching because she was so itchy, she was scratching her skin raw. I mean, this poor woman was really, really struggling and wasn't having any kind of results with conventional medicine. So this was a huge tip because this is what helped her feel like her skin wasn't crawling, because she could actually feel the bugs in her skin and on her skin. And she had like a crawling sensation. So she would just dab a little bit on the not open areas. Why the not open areas? Well, if you put this in, so say she has a scratch and it's open and there's blood, and you put that in, it'll sting a lot. So on the closed skin rashes, she dabbed Woo all over both of her legs. She probably smelled minty fresh, and that really, really helped her with the itching. Parasites are more active when? At night. So at night, she would just be tortured and want to scratch her legs raw. She would apply this at night and she could actually sleep. And we know that she needs to sleep in order to heal. So I just want to share a little case study with you in the Woo. If you were to see this patient today, her skin looks much, 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 much better. She's doing much better. So hopefully that tip helps you. Woo or Woo oil, China heel oil from Systemic Formulas, double thumbs up.